there. Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and you guys know who this is, Dr. Susan Maples, the goddess of everything oral systemic health. Susan, it's so nice to see you, my friend.
Thank you, Kelly. It's such an honor to be here. Appreciate that.
Yeah, you are such a light in the dental world, oral systemic, everything, and you are leading by example, and I cannot wait for people to hear your story. But first, I always ask, why dentistry? Like, what drew you to it? Did it choose you? Did you choose it?
Well, I always want to be truthful, so I don't like starting with, well, tell you the truth, but I always want to be truthful. So you asked a really delicate question. At a young age, I saw my parents divorce, and I was only, I think 3 or 4. And my mom was struggling to figure out what she wanted to do. She started working on a PhD and working, and I wanted to make sure that I had my ducks in a row and had a career of my own. But I also really loved working with children, and I was a very sick child. And all of this came together for me at the age of 9 when I got into some early orthodontics and started really finding an interest in what the orthodontist was doing. And I started to feel better around, 12 or 13 with the help of a physician. But I always wanted to be in a caring profession. I wanted my own thing. And I chose dentistry at the age of 9, which is highly unusual. My parents thought I was far too creative to be a dentist. They thought dentistry was going to be very boring for me. And they tried to dissuade me a number of times, both my mom and my dad. But I stuck it out, and I'm super happy I did.
Wow. That's quite a story. So you chose it at 9. Was it because you started feeling better and you recognized the difference that it could make in people's lives, you think?
I don't think so. I had a mechanical interest in art. I was a sick child and a lot of indoor play. As some of you know my backstory, I was born with 2 parents who smoked 2 packs a day each and was hospitalized 7 times from pneumonia under the age of 12. But I also had 52 allergies. And so I had a lot of indoor play, and I had developed a lot of interest in art. And when I saw him doing all that stuff with the wires, and then he was an ice boater with me, and we were competitive ice boaters. And so he allowed me to go back and watch them pour the models. And it looked like a lot of arts and crafts for me. And I also loved treating children, and it seemed like a cool environment. Mm-hmm. So I don't know. I think I started to feel better thinking I probably could. I don't think sick kids have a lot of hope for being able to go through rigorous curriculum. Mm. They're sick. And if you've ever been a sick or oxygen deprived kid, you're barely hanging on. So I started to see myself developing more of a career mindset, even at that age, watching my mom struggle, thinking, I think I want to figure out how to create a career before I ever get married,
Yeah. So you were, and probably you were independent minded at that time too. Like, how can I be independent, do what I love, and bring it all together? But that is a very young age. So when you entered dental school, was it a delightful surprise to you? Was it everything you thought it would be?
Lots of arts and crafts and lots of science and lots of interest. Yeah, I didn't even know there were 32 teeth in the mouth. I didn't know a lot about it when I entered dental school, but I did know that it was a caring profession and that I could develop one-on-one relationships. And I kind of went into dental school thinking I might want to go into ortho, but I got so caught up in restorative dentistry that I thought I should be a restorative dentist for a while because I won't be able to go back. And then ended up really starting to layer and layer and layer on so many different areas. Of course, dentistry's grown up a lot in my time, but so have the problems facing our world. And so there's been no end to the amount of restoration. We're no different from the rest of the Western world that's just putting Band-Aids on top of melanomas, right? Mm-hmm. We're busy. When I say, if we had a fire burning in our house, would we call the carpenter to fix the roof while the fire's still licking away at the floorboards? Of course not. We'd call 911, we'd put the fire out, we'd figure out what caused the fire, all before the restorative plan. And so while we've had plenty of work to do, and unfortunately we only get paid to restore, not to help think, not to redirect, not to facilitate health change behavior, not to make the big differences in people's lives. We don't get paid for that. We only get paid to put the roof back on.
Yeah.
And so oftentimes we skip putting out the fire, right?
Yeah, we do. Because of time constraints, because we get burnt out. I think a lot of times, I think we know the oral systemic connection. A lot of us do, but it's how do you?
Burnout might be one reason, Kelly. I often think sometimes we don't feel like we have the resources, or we don't know, or we're living in that world ourselves, sick and unhealthy. And, dentistry is no different from any other profession. We have lots of people who are eating out of a garbage can and getting no sleep and, all the rest.
Yeah, true. And to your point as well, when it comes down to it and you're making that referral to someone and you are collaborating with an internist or endocrinologist, whatever kind of type of doctor you're referring to, do we have those systems in place? Do you know how to handle that within your office? And Susan, where did you start with that? Because I know that you have a unique and amazing practice that you told me about when we first met.
Yeah, about half our patients come from the medical profession, actually a little more than half now. So we have really good co-referral sources. We started, I've been curious about how to speak their language so that I can communicate with them. We talk a good talk about collaborating and talking to each other when we're in dental school, but really in the real world, it really doesn't happen. So I was frustrated by, I'm only one person, I'm thinking by myself, but I know there's a lot more here. And I started out doing extensive interviews of my patients in the verbal health history before we ever look in their mouth. And I learn a lot from them, but then it just piqued my curiosity. One of the questions I would always ask is, and I could ask you this in your personal life, Kelly, do you have anyone on your healthcare team caring for yourself or your family right now who you would really rave about, who you think is just terrific? And what would be the answer to that, Kelly?
Yes, I do.
Okay, so I would say, tell me about that person. And now you might give me the qualities that you admire. So go ahead, give me a couple of qualities of the person you're thinking of.
Well, they listen to me. They are helping me problem solve collaboratively. They are helping me think long-term, short-term, and long-term about my health goals. So those are a few.
So one of the things you said first is they listen to you. And that is huge because we know statistically you have better outcomes when you're heard and understood and they're taking into account your thoughts, ideas, behaviors, mindsets. Because if that is true, then they're also altering their recommendations based on what they learn about you. So we work together much better. So if I were to ask you the name of this person and you're my patient, I would write a handwritten note to them, thanking them for being in the community, telling them, I just interviewed Kelly Tanner as a new patient, and boy, she just really raved about you. Here's what she said. You're the kind of people we want to work with. We'd love to refer more to you. I just wanted to say thank you for being in our community. And then my health relationship coordinator, a person dedicated to that aspect of the practice, is communicating with the office to see if they'll accept referrals. Then I started a wellness and prevention study club based on we kept hearing the same names over and over, right? The same 12, 15 names in our community. And I was like, we need to study together. I need to know these people. They need to be my friends. So now if we're on this call and something came up and you said, look, I've got a problem, or I have a child who has a problem. What do you know about this? And if I couldn't answer it, I'm happy to say, I don't know, but I work with a whole group of people who can help me get those answers, even if they don't. So while we're on the phone or while I'm with my patient, I can literally text thread a dozen of my docs throughout the country, but especially in my community, if we're looking for a community resource, to say who can help me solve this problem. And together we do it. I get almost, how many times do you look at your phone in a day? They look at their phones too, and they'll text me back. Also, they're the best and brightest docs in the area, and they don't see new patients, but they see mine. I'll text them and say, I'm referring a patient to you. You let your business team know, because we're friends and we refer to each other.
I love that. Well, you said a lot of things where you're reaching out to them and you're saying, "Hi, I'm a dentist in your area who cares about this, and I would like to connect with you and say thank you and appreciate that you're a part of this community." And so you're nurturing that relationship from the start. And I love, Susan, too, that you acknowledge and validate what I was feeling and probably what a lot of our listeners feel when I would go to conferences and present on posters and talk about collaborative health and all the buzzwords, right? We would come and we would know all the problems, but no one would know any of the solutions of how to get started. And we're like, I don't know, what do you do? I don't know what you do. And so, do you, Susan, when I know that you're leading many groups and you're a part of many groups, do you help folks, other providers, other dentists, other practitioners work through the model that you're using?
Sometimes, like you're helping right now, we're talking about this. People may listen. They might be more curious. This week with ASAP pathway, do you know ASAP?
Mm-hmm.
Uh-huh. So Stacy interviewed me with my health relationship coordinator. We did an hour-long podcast just on her role and how we developed this co-referral relationship. And we could talk for hours about it. But sometimes I do when people are curious or interested. I have two groups that I'm super proud to be part of, and one is AOSH, American Academy for Oral and Systemic Health, and also AAPMD, American Academy for Physiologic Medicine and Dentistry, but also the Academy for Private Dental Practice.
Mm.
Private dental practice is becoming not a unique bird, but to do it well. I mean, I'm super proud to be a private practitioner where no one's telling me what numbers I have to reach or who, we do very well without that. And we can intuitively decide to spend the time and interest in ways that we want, create our own palette. And this academy, the Academy for Private Dental Practice, there are a lot of people in there who are curious about different ways of being successful in private practice. And so I guess through that and through these other academies, they featured some of the models that we've developed in our office. But I would say sometimes, and of course, Total Health Academy, which is my online learning academy, goes into that pretty extensively.
Yeah, it's because I think that that's where people feel like they're up against a wall. You can come into an office wanting to change the world with anything. And if you don't feel like you have a workflow for it, if you feel like you're having to convince other folks when you come back to do it, or if they're not, if they're on your same brainwave, essentially, then you're going to meet a potential barrier. And I think to create and you and I were talking about this the first time that we met, how to create an understanding where it's just the standard of care and how we do in dentistry, and how do we start as a profession. And AOSH, I know, has grown in numbers and popularity, even in, oh my gosh, how long has that organization been in existence? 10 years?
12. But,
10?
Sadly, Kelly, I would have to disagree. As part of the leadership for AOSH and past president, I would say that it's not growing nearly at the rate that I would be pleased to see. This is something that's not, what we're practicing is not something a quick fix that adds to your bottom line tomorrow. I mean, my practice attracts people who are health oriented. Those are the same people who accept your treatment plan. They come in with a level of trust. Just imagine being referred by your physician. And then having someone really take the time to sit and listen and talk and figure out what you want. Today is my new patient day, 2 hours, actually 2.5 hours. And then the second was 2 hours and 15 minutes. That's all I do on Wednesdays is 2 new patient adults. And those are extensive. The treatment plan for the first one was sizable. The second one also, though we're going to consult collaboratively with an implant surgeon for a significant reconstruction. These are cases that I consider train wreck cases. Now, they're not all that way, but I get these referrals from people who haven't been feeling well, who are on a health journey. and they come ready to have an experience because we interview them before they ever come in to see if they're a good fit for the practice.
Mm.
I'm not giving a couple of hours of my clinic time away to somebody that isn't a good fit.
Yeah.
So that's part of Jean's job as the HRC, Health Relationship Coordinator. But this model definitely makes a financially more successful practice. But AOSH doesn't teach you how to make money at this. So we notice a lot of people come, they're interested, they learn. They might come once or twice, then they skip a year or two, but it isn't like anything else in dentistry where you could just go to a class and all of a sudden you're adding a procedure and a code and a fee.
Right.
You know what I mean?
Yeah. So how do they learn that? Do they learn that through your website? Do you teach that?
I mean, I always talk about the profitability of this because I think if you don't have a profitable practice, you're not really able to sustain it. And I want it to be very sustainable.
Right. And profit isn't for those of, I know that a lot of my audience, sometimes it's dentistry and profit go together, but you got to stay open. You have to be able to afford and to be an abundance mindset, because if you don't have a code that goes along with what you're doing, how are you going to get reimbursed or paid? And I know that when you and I spoke, you were talking about how to look at the medical codes to utilize and leverage those as well.
Yep. But I also think I'm not a money-driven person. I do look backs. In other words, we don't have production goals daily, things like that. We look back on the month and take a look, and about 10% of what we do is for people in need. So we make sure we're meeting that quota. We're doing things the right way, and we're successful anyway. And part of it is because we're not insurance dependent. And I'm not talking about the fact that insurance is dock you for money. I'm talking about our mindset is such that we help people access solutions to what they're looking for, regardless of what their insurance covers. And we help give them some affordable ways to accomplish that. Mm-hmm. And people want it, choose it for themselves. We all know that dental insurance is a token. It's a small gift from their employer toward their care. And we have become a profession that relies on looking at what the insurance allows almost before we make the treatment plan.
I know.
Which is
disheartening.
Nuts.
And disgusting, I think. And a lot, I'll say
not the way we'd want to be treated, right?
Yeah, that's not how I would want to be treated as the patient. Mm-hmm. I want to know what it is. And I am the first time I met you, I was thinking back to our conversation. I feel like we spoke for 2 hours, but because I was just mesmerized by how your practice operates. And so you've not only created a hub of folks who you're collaborating with, because you can text them on your text string. You also have pre-qualified, if you will, those folks who you're seeing and you're spending your time with to ensure that they are the right fit for you. So can you talk about how to even start an office culture with that in mind? Like if someone wanted to start today and said, Susan, I want to emulate exactly what you're doing, how do you even start with your office culture and the people that you're hiring?
Well, I would, if you were to start today, I would sit down with your team and discuss your steward team, the people you really believe that are behind you, and establish what we call core values, 4 or 5 or 6 principal values that you rest upon, that no matter what you're doing, whether you were doing class 1 composites all day or whether you were doing airway and oral systemic health or ortho or whatever, selling widgets, that you would absolutely unequivocally stand on. Mm-hmm. And if you can find those values, then you start hiring for values. So our practice is represented by some incredible caregivers, team members in every aspect. And their personalities are A to Z. We have lots of different personalities, just like the world does. But our values are rock solid and I can share with you what mine are, but they may not be yours. Ours are integrity, do the right thing no matter what. Another one is what we kind of consider our working core values of kindness, compassion, integrity, those personal skills. But really, we like a commitment to perpetual improvement. So continual learners.
Mm-hmm.
People are never satisfied with what they know. They're always curious about what else.
Yeah.
We also are, so along with personal and professional development, we are interested in people who are good communicators, who like to learn the art of communication, who like to learn how to listen better, how to facilitate better. They're not there to just give people post-op instructions or do just these. It's sometimes dehumanizing the way that people talk to us in healthcare. They just spiel off something. They don't even know who they're looking at sometimes. So, and then we have a value for fun. So fun is one of we've actually gone through the whole hiring process, and if someone couldn't bring fun, we couldn't do it. So that was interesting. What else? Let's see, personal, professional. You can see them, they're right on our website, but we ask values-based questions, and we organize our team members around these values. They are, by the way, the same values that we have found in the physicians who are in our wellness and prevention study lab. Again, continual learners, thirst for perpetual improvement, true curiosity for learning, and then integrity and great, great compassion for people and listening to people. So these values that we aspire to, and I think team-mindedness, that we don't put anyone above each other, that we are very much, I'm a dentist, so I have certain licensure to do some things that other people don't. You're a hygienist, and you have a licensure for some of you. You're a PhD, so you might be able to teach some things that other hygienists aren't. But I will say that we all have our own particular gifts, none better than the other. And so I think there's a level playing field there. So that's part of the culture, is just continue to learn together.
Yeah. And then you can use those core values. I love when I get to work with teams and we get to establish core values, because that truly drives every interaction that you have, like inside out, performance evaluations.
Well, and think about all the things that we're developing and the change it requires. If you've got a team that is not a continual learner, they're not interested in change, they're going to buck you the entire way.
Yeah.
You also maybe have people that are just telling you, smiling and going along with you, but inside they're going, oh my gosh, really? You want people who are able to be forthright enough to even be your naysayers, to be able to say, wait, I could foresee a problem. Let's talk through it before we do it. You want some contrarians in the group. So you want a team environment. And then I think retreats are important, off-site retreats where we get together as a group with a facilitator. That's not me, so I can be part of the problem and part of the solution.
Yeah, that's important.
And to hammer out, like, if we're going to change some things, how do we do that? What are the roles and responsibilities that we're each able to take, and what are our next steps, and to hold each other accountable for those.
Yeah.
Total Health Academy is probably a 3 to 5 year curriculum if you were to take it on, because I believe we should take it in chunks. They say, how do you eat an elephant? One bite at a time, right?
Right.
You can't get there overnight. And it becomes the commitment to the journey and the enjoyment of where we've come and where we're going, and the learning itself. If you don't have people that love learning, they're probably not going to stay on the ship if that's one of your values.
Yeah. Yeah, that's my love language. I feel like I almost to a fault. I'm like, I just want to learn more. But so tell me more about Total Health Academy. Does this, I know that I don't know. I know some parts of it where it's helping the practitioner learn different skill sets and different ways of looking at certain conditions, et cetera. But are you also teaching the practice management part of it?
Yes, there are. When I first started speaking on oral and systemic health, Henry Schein actually was trying to do a big awareness campaign, and they hired me to speak 30 days a year, which is a lot.
Mm.
And they put me in front of general dental audiences, people that knew nothing about, they're not doing any infant oral health, they're not doing any airway, they weren't doing really, they didn't have a mindset for perio, they were just scraping teeth and billing for SRP and not looking at trying to create a microbial shift that would, dictate long-term solution, stability. They also were not aware of acid reflux, didn't really understand how that was happening or what it was doing in the mouth, weren't dealing with fungal infections. So I would come in for a full day and I would do a full day's talk, and then I would leave, and I was in a different city all the time. And everyone in the audience is like, we need more. I want to know how to do this. I see these pictures. I see what she's done. I don't know how to do it. So they put pressure on me to create this online learning academy that they were going to sell. Since then, they've totally gotten out of the continuing education for oral systemic health business. But Total Health Academy, though I was sort of forced into it, not forced into it, I was arm wrestled into it. I'm really happy that I've done it. It's an online academy where people, there are, I don't know how many modules there are, maybe 68 modules of learning. They're either between 25 minutes and an hour. And so your whole team goes to school on their own time. Usually it's not done in a team meeting setting. It's done at home like we're doing. And then everybody comes to work and then sits down and says, okay, as a result of what we learned, what are we going to do? There's a coaching component if you want it. You don't have to have it. But it's how to eat the elephant one bite at a time. And I think of it like going to a restaurant and opening up a really extensive menu and saying, what do I feel like eating and in what order? So part of it is if you have a passion for, let's say you have a loved one who was just diagnosed with HPV oral pharyngeal cancer, and you're on a campaign to try to prevent that, and you want to learn how do we help people learn about oral sex and oral cancer, and how do we test for HPV in saliva, and how do we communicate to surgeons or to ENTs for scoping, looking for these lesions, and what do we do about the reflux that might increase their chances of having this? How do we help them tap down the alcohol? All of that during these episodes where they're trying to heal an HPV lesion before it becomes cancerous. I might have just said a whole bunch of things right now in 1 minute that one of our listeners may have no clue about. No clue that 73% of the cancers we see now are in the back of the throat and the tonsillar pillars in areas you can't see. We are not doing an oral cancer screening by pulling the tongue out and looking on the floor of the mouth. We just are not.
Yeah.
Stop fooling ourselves, right?
Yeah.
So let's say you wanted to start there. That's where we would start, and we would figure out how to do a practice-wide campaign during that oral cancer screening where we're teaching our patients what we're doing and why we're spending more time in the neck and what to look for in neck nodes and why that is so important, and maybe talking about their views on vaccinations for kids and how we can prevent this wretched head and neck cancer. And that's doing some help. That is doing some help, right? Maybe they want to go from there right into smoking cessations. So we can help people with periodontal disease and oral cancer risk. And they do a module on smoking cessation. And now we want to talk about how are we going to implement smoking cessation in our practice. So it's like following rabbit holes and figuring out what you want to eat next. Yeah. Maybe it's diabetes detection. Maybe it's running the whole perio bundle of how we bundle perio therapy and make that successful. Maybe it's talking about marketing a total health practice. All of that is in there. So
yeah, it's an amazing resource, it sounds like, for that practice who is interested in going in that direction. And of course, you're a wealth of information to say, hey, here's where we are with this. Where would you recommend that we go? You're a click away to ask those questions.
Yep.
Well, Susan, it is an honor to have you. I feel like I know that I could talk to you for 8 more hours.
What's your biggest interest in all of this?
Say that again.
What's your greatest interest in all of this?
My greatest interest in all of this is because we don't know what we don't know. And I think that one, I understand from the consulting that I do, we know what we should be doing. Just as simple as doing perio charting. Okay, that's only one small part of what we should be doing. Some hygienists will say, no, I know my patient, I don't need to perio chart.
Huh?
Or some doctors will say that. I know my patient, I don't need to do that. And that.
Or perio chart without looking at bleeding points.
Or any of it, right? Just even starting with what we know that is part of the bread and butter of our assessment. And so understanding people's mindset on where they got probably lost in that, and to help them connect back to what is essential, what's vital information that must be gathered during that appointment to do anything, to give the patient information about even the next step or about what you're finding now. But it comes down to the basics, but then there's so many more questions that I'm interested in of how are we looking at gut health? How are we referring our patients for their micronutrients to understand how their bodies are processing things, are fighting that inflammatory response? Because we're just putting together a cookie cutter approach to a lot of things, and it's just one size fits all, and that's not good enough.
Yeah,
it's something.
When I wrote Brave Parent, raising healthy, happy kids against all odds in today's world, I was very much interested in where we're seeing all these allergies and autoimmune problems from. And of course, we know it's gut health. We know it's the microbiome and what we're doing. Everything from the lack of diversity of our food to over sanitizing our environments to indoor play versus outdoor play. I mean, the list goes on and on about early exposure to antibiotics, and that whole aspect of health is something in dentistry we don't even think about, even though we're working in a mouth that has up to 900 species of bugs, its own microbiome.
Yeah.
We're not really even thinking about how, other than telling people you have dry mouth, that's why you're getting cavities. We're not really even thinking about how do we test that and how do we help the patient restore that. And even if you're not willing to test, to understand better about restoring that. And perio, the paradigm shift in perio treatment is so far away from scraping teeth and throwing a toothbrush in a bag. I can't even tell you.
I know.
And yet insurance companies are still paying the same way and people are still doing the same thing.
Which then reinforces the behavior that we're in.
Exactly. It totally does.
It's like, you guys, okay, think outside of this. Think about what you know. What do you know? What did you learn just in hygiene school? But I mean, even taking it back 20 years, you knew that you needed to follow a certain protocol because it passed the litmus test of even where you start. To know anything else about that patient, your body is changing constantly. Our bodies, when a patient, okay, so when health turns into a disease with our patient, how do you have that conversation with them?
And a complicated, multifactorial, long-term chronic disease.
Yes.
You don't do it with a sharp instrument and a piece of string.
Yes. And it's a site-specific response or manifestation to an internal problem. Okay. And so how are we coming up with the solution for that? So that's my quest, Susan, to answer your question.
I love it.
Is for us to ask better questions and to start with the basics, but to layer on to help the patients understand that we are helping them. If we don't have those chair side ways of doing it in every single dental practice forever, that how do we help them connect to where they need to be and
Absolutely.
where they're next on their journey.
I love that. We need people like you every day in every way. So thank you for carrying on and carrying the torch and being patient, waiting for me for this podcast too.
Oh no, this technology, it's life. So it's thank you for you and all the work that you're doing. And you guys, if you don't know Susan, she is a light in this world. You just being around you just makes you want to be a better person, Susan.
Well,
So
you're so sweet. Thank you. I love what I'm doing. And I made a promise to myself at a young age that if I could help people the way my physician helped me out of a really, really bad health trajectory, I would do it. And I do it every day. And people ask me, I'm going to be 65 in January. And a lot of my friends are retiring. Like, why don't you want to retire? It's like, I love this. So, you know how people say on your deathbed, you won't wish you'd worked another day? That will not be the case for me. We're all different. And I am driven by the lives. I love a purposeful life.
mhm.
And I think that as we search for meaning in our lives and at the end of our lives, looking back on what has been the meaning, what have I done that has been important to me or important to the world, I know where I stand. I get frustrated at the lack of progress and lack of speed of all of this. I watch the world getting sicker. We're in the largest decline in human health we've ever known in the history of the human race, and it's 85% preventable.
Yeah.
So it's frustrating, and I want to cry 1,000 tears over that. But I'm doing my part, and I know that if you're listening to this show, you are doing your part also. So I want to thank you, the listener, for being here, for the courage to not only to learn, but to walk the talk and to set good examples to the people around you. And I am especially grateful for you, Kelly.
Thank you, Susan.
Yeah.
I feel that. Well, thank you so much again to our listeners. Thank you for being a part of our audience and for the lives that you touch every single day. And you all know that I always ask a favor of you, if you wouldn't mind going over to Apple Podcast and giving us a 5-star review, because Apple's the one that matters. And then going over to YouTube to like, subscribe, and share to all the people that you know who would love to just learn more about technology, leadership, communication, and saving lives. Thank you, everyone, and I will see you soon. Take care, Susan.
Thank you. Thanks, Kelly.